Hello, my name is Mehdi. I've just finished my second year at Sofia Medical University and I'd like to talk to you more about the subjects studied in second year. So you start off by picking up histology in the second year, so the third semester. Histology is done with the anatomy exam, so it's like a part you do before the actual anatomy oral exam. It's not a stop test for dental students, and it's basically where you look at slides, try to identify as many slides as you can. And I think in total you get 4 slides and you need at least two identified slides correctly to be able to pass. After that you do your anatomy exam, which is in Jan. So after taking it for 3 semesters, including 2 from the first year, you do the anatomy exam in January. Anatomy doesn't really change from second to third semester, it's generally the same. Maybe your teacher will just change. For the exam for anatomy, you get 6 questions in the oral, obviously 1 question from each section. In the syllabus you can see it's separated out into 6 parts. It's important that you do know your question from every section, because in anatomy you generally need 5 or 6, depending on which examiner you have, to pass the exam. So it's not like cytology where you might be allowed off with like 4 or 5. In anatomy you do need most likely 6 with most examiners. So the second subject you pick up in second year will be psychology. Psychology is relatively easy compared to the other scientific subjects. For psychology, generally the teacher, he or she, they do the seminar themselves, but every week a different student is given a topic to prepare a presentation slide for that topic. So you will have to present, like you take it in turns 1 week each to present a certain topic for psychology. The exam for that is relatively quick. You do a written part, your whole group get the same question for the written part. You do it in a lecture hall, and then for the oral, after you finish the written part, they mark it and you wait half an hour. And then for the oral, you go into a classroom where you'll be examined one by one by 2 professors at the same time. Biochemistry is just a continuation from when you pick up in second semester and first year, so you just carry on doing the same things. Generally, they might switch teachers, they might not. The exam for biochemistry, there's no practical, it's just an oral part. It's just an oral exam. So you go into the exam and you get 2 questions, one from the first section and another question from the second section, and the exam usually lasts about 15 minutes. For biochemistry, I would suggest that you actually revise the whole syllabus, because they don't stick to your question. They ask you your question and then they hover onto other subjects and other cycles. So they will ask you questions that aren't relevant to yours. So for biochemistry, it's important you know the whole syllabus, including all the cycles and enzymes used in the cycles for specific reactions, or at least just the general function of general enzymes. For example, kinase enzymes. You don't need to know the specific ones necessarily, but you just know generally what they do and what their method is of activation. The 4th exam you have in January in second year is Biophysics. Biophysics isn't the hardest subject, considering there's only 22 points on the syllabus. So it's relatively quick to revise. I mean, I studied it in about 4 days, the whole syllabus. I did have a bit of general knowledge, but I think 4 days is enough to get a high mark for biophysics. With biophysics, I'd say mainly it's important to obviously know the information, but what they're really looking for, or what they were looking for in my exam, was the equations for the exam. So whoever had equations generally got a higher mark, and those who didn't had a hard time passing. I know a few people who did fail biophysics, and that's mainly because they didn't have equations listed, because with biophysics almost every question there's an equation to it. So if you know the equation and you're able to explain them, then generally you should be fine for biophysics. But of course you also have to know the explanations for it. For Bulgarian language, I mean, you've taken it in first year, so you know generally what it's like. But the main difference I'd say between first and second year language is they move on from general basics to more medical terminology. So you do start to learn the more important things in Bulgarian language when you're in second year, especially towards the end. For the exam for Bulgarian language, each teacher does it differently from what I know, and there are a lot of teachers for Bulgarian language. So, but my exam, we had a paragraph to learn. We had several paragraphs to learn, and we just get any paragraph and we'd have to be able to just recite it on the spot, and then she'd ask you questions about different parts of the paragraph. So obviously ours was dental related, so it was dental related paragraph of how you can form caries and plaque. So she'd ask different questions within the paragraph. In second semester, in second year, you pick up a subject called disaster medicine. Disaster medicine I'd put in the same category as psychology and social med, where they're not really scientific subjects, but they have some importance to know just for, I'd say, background information, because with disaster med, you're looking at earthquakes, floods, some chemical prophylaxis, so you're just looking at how they affect people who may come to your surgery. So it is relatively important, but not as important obviously as other subjects. And the exam for that is you have a written. So before you break up for the Easter holidays, your teacher will give everyone a specific question. You get 3 questions, and then you do a PowerPoint or just an essay on them. So it's about, I'd say, 10 to 13 pages long for all 3 questions combined. And then in the exam, you literally get one of those 3 questions to answer. So, and generally everyone writes about 2 sides for each question. So it is easy because you're literally getting 1 out of 3 potential questions for disaster medicine. Or if you don't get one of your 3 questions, you will get either flooding or earthquakes, which is really easy. So disaster med is probably one of the easiest exams in the whole first 2 years. For social medicine, you pick that up in 4th semester, so the 2nd semester and 2nd year. That carries on to the 1st semester and 3rd year, but you do have an exam at the end of 2nd year, because I think when you take it after 2nd year, when you take it in 3rd year, I think they changed the name to public health, but it's more or less related to social medicine. The lessons for that are, the teacher gives a PowerPoint for most of them, but it's the same as psychology, so every week a different student is given a different topic to talk about. So you have to make your own PowerPoint presentation and present it to your group for your specific week. And the exam for that, it's similar to psychology as well. You have a written part where your whole group do the same one, and then after that you have an oral. So I think for social medicine, it's important you learn all the definitions. So obviously you have the definition of health and incidence, prevalence, all those important definitions. And when you answer your questions, start off with the definitions, because most people that did fail that exam is because they didn't know their definitions. So for that exam, I'd say definitions is one of the most important things. Physiology is picked up in the 1st semester and 2nd year, and the actual exam for it is at the end of the year, so you do it in June. Physiology, I'd say, was my hardest subject, my hardest exam to take, because there is a lot of content to the syllabus and there's quite a bit of depth to physiology, sort of like anatomy combined with the science. So you're looking at anatomy combined with a bit of cytology and just how everything works. So you need to know, obviously, your anatomy, because it helps, because you know what organs you're talking about, and you need to know the science of how the mechanisms work and everything. So I'd say physiology is definitely one of the hardest subjects in 2nd year. For the exam for that, there is a practical part. I don't think anyone did fail the practical part, so for the practical, it's quite easy to study for that. And then after that, there's an oral where you get 2 questions. No, sorry, you get 3 questions. You get 1 written and 2 oral. So the written ones, you get examined by 2 professors. The first professor usually examines the written and 1 oral, and the second professor usually examines just your 2nd oral question. And in the end, you do have to pass all 3 questions and the practical to pass the exam. So for that exam, I'd say a deep amount of knowledge is required compared to the other science subjects that you've taken before. For physiology, I studied using a textbook. I don't have it with me actually, because I gave it to a friend to borrow, just remembered. But it's the Constanzo textbook, 4th edition or 5th edition, it doesn't really matter. But studying physiology from a textbook compared to notes is better, because in the textbook, when they explain something, they'd usually give you a diagram. So if they explain a mechanism, you'd have like a diagram showing you where it happens and what happens and how it happens. So when you have a picture, obviously it's always easy to study, because it's easier to remember pictures than it is just a lot of text in your face. So it's easier to understand, and then it is easier to remember, because when you go into the exam, you'll be like, oh yeah, I remember the mechanism, the picture looked like this, and it will kind of jog your memory, as opposed to just words where everything just looks the same. The exam for prosthetics is probably the longest in total combined, because you have a practical which you do, and then you have a oral part which you do. For the practical, it could be before or after your oral, which depends on which group you're on, how your schedule is. But it's usually a 2-day exam, so you're doing 8 hours a day, The breaks aren't, there's no specified breaks, but when you want, you can generally take a break whenever you want, but you just need to remember that when you take a break, you are eating into your own time. So if you're someone who's still working in prosthetics, you would probably need most of the time doing your work. But if you're a bit better with your prosthetics and your hand skills, then you definitely won't need the whole 16 hours over the 2 days. Because I took quite a few breaks and I still managed to finish about half an hour earlier. So for prosthetics, just manage your time for the practical part. I'd say it's the most important thing. And then after the practical, you'll have your oral, or before you'll have your oral. For the oral exam, you get 2 questions, and they are both oral questions. So obviously you need to know your 2 questions. And then after that, generally you're given a random tooth, or you're told to pick a random tooth, and you need to identify the tooth. So if it's upper or lower, and which side of the mouth it's on, and obviously what tooth it is, and be able to say the name in Latin, and say which tooth it is, basically in Latin. The last exam you have in your June exam season for second year is Microbiology. Now microbiology, it has 3 parts of the exam. You do a multiple choice, so you're given 13 questions, and as far as I know, it's not a stop test, but obviously if you do score higher, it is better because they do look at it when you go to do an oral exam. So I'd say try to get a good mark on that, which you should do if you have studied the syllabus, because it's not like biology where the questions are a bit hard for biology. But with microbiology, if you study the syllabus, you should easily get minimum 10 out of 13 for the multiple choice, so that shouldn't be a problem. After the multiple choice, you go back into the lecture hall with everyone doing the exam, and you each pick a ticket, and on the ticket there are 4 questions, so you have 1 practical question and 3 oral questions, obviously. So you don't get to see all your questions. The only question they tell you is your practical question. So for the practical, depending on your question, some students will be taken downstairs to physically carry out the practical. So if you have gram staining or nicer staining practical, you'll be taken downstairs to the lab to carry that out. If not, then, so if you get a question, for example, sterilization for your practical, then you'll just be sat in the lecture hall and you'd have to answer it on paper. And then the professor will come to you and you just have to briefly explain to them, obviously, the procedures for the practical question that you got. For the oral part of the exam, you get 3 questions. It's usually, as far as I know, it should be 1 question from each section, but I did get 2 questions from the 3rd section. So I got 2 questions from the bacteria section, but I think that was just a one-off or very few. For the exam, I studied with a text. I studied with this textbook for the exam, Medical Microbiology. It is quite in a bit of detail, but you definitely don't need all the details. So you'd have to look at the syllabus and pick out which parts you actually need and which parts you don't. And if you study from this, you'll be more confident to pass in the exam, because if you know the information on your topic from the textbook, then obviously you can't go wrong, as opposed to using maybe your friend's notes or something, which may actually be missing some key information. Because they usually are with students, they do make a lot of mistakes when they make notes. So I would suggest to obviously study from the textbooks or from the lecture slides from the professors. Pharmacology is picked up in second year, obviously, but the exam for that is in third year in January. For pharmacology in the seminars, what you generally do is, in the first seminar, obviously you learn how to write a prescription. So obviously there's different parts and it's structured. And there's a universal format for writing a prescription, so you do need to learn that. And then from there onwards, you generally learn about all the different medicines you can use for different situations. So you're learning usually the chemical names or the branding that make the medicine. And obviously for every situation, there are several different medicines that can be applied. So you learn which one you would use for which situation and how much you would need to prescribe. So the amount in milligrams, or if it's oral, or applied on skin. Obviously there's different methods. Pediatrics is also picked up in second year, but the exam for that, like pharmacology, is in third year in January. Pediatrics in the first semester, so what I've done so far is usually go to the seminars and you do a lot of drawings mainly. I think the drawings are so you can understand more how the embryological development of teeth work, because obviously the subject is pediatrics, so you're looking at children and kids and primary eruption of teeth. So obviously you have to learn where they erupt from and how they do it and how long they take. So with pictures, that is a lot easier to learn. So I think that's why they use the method of drawing it out a lot of pictures. The last subject you pick up in second year is conservatives. Now conservatives is also picked up in your second semester and second year, like pediatrics. With conservatives, you're doing a lot of handwork. So I'd say it's the first actual subject in the first 2 years where you actually feel like you're doing dental work, because you go into the rooms with the actual machines. So you have obviously the air spray and the water sprays, and you're given a model of teeth, and on that you perform different functions. For conservatives, what you do generally is you do different things. For example, you perform cavities, and obviously there's different classes of cavities. So you are shown by the professor what to do, and it's important to do it the right size and obviously the right depth. You do have different tools to allow you to measure how deep it is, because usually you are working in millimeters. So millimeters is hard to see with your own eyes. It's hard to identify how many millimeters it is precisely. So it is important the work is precise, so you are given tools to measure. For conservatives, there is actually a book sold by the lecturer, which is this book here. I'm not sure if it's sold outside the university, but for this, when you start, she'll tell you where her office is, and I think it's quite a cheap book to buy. And it's quite useful for preparing for your seminars, because you can read ahead and know how to perform what you need to perform for that lesson in particular. At the end of the semester in second year, you are required to find an actual human tooth for that one, and it usually should be a premolar or a molar, although your professor will tell you in the seminar at the time when you need to do it. And for that, you usually perform a cavity, so the same thing you've been performing on your other models. But obviously this one is on a real human tooth, so it's a bit of a different feel, but generally it's the same basic idea. But obviously it needs to get you started on a real human tooth for when you go to third year. For conservatives, when you actually need to find a human tooth, obviously a lot of people are going to be confused over how to find one. I mean, the professors, they rarely do give out teeth, and if they do, there's very few, definitely not enough for the whole year. So what I done is I went to one of my friends in fourth year, and he does do a lot of tooth extractions because he's got patients, obviously. So he gave me a tub with a few teeth in it. I don't know if it's visible, but there's incisors and premolars in there mainly. He didn't have any molars on him. What you can also do is, if you don't know anyone in the upper years, or if they don't have teeth, because sometimes they themselves need them for their exams, you can go to dentists, like different dental practices. They don't need to be related to the university. And I think some people did do that, and they just explained they need a tooth, they're dental students, and they need a tooth to work on for their conservatives. And usually the dentists, they do give them any spare teeth that they have. So I think that's what quite a few people did do. Another thing to mention is that it is useful to pick up extra credits. So for example, when you do sports, that's generally to acquire extra credits for your final degree. What there is in the university, there's also extra credits lectures. I think it's available to all years, so you could do it in second year, third year, or you can do it every single year, and every year that you do it, there's an exam at the end. It's a relatively easy exam, and you pick up 1.5 credits for passing the exam and attending at least 5 lectures. So the certificate looks something like this. Obviously it's just got the university name, and they'll have your name and a stamp and what the extra credit lectures was talking about mainly. So I think that's quite important to attend. Also, I'd just like to give you some advice, or rather my personal experience. So in second year, second semester, you do have a lot of free time. Although you are studying your hardest subject so far, you do have a lot more free time compared to your other first 3 semesters. So sometimes what that does is it makes you cool down from your studies. So because you're not in university all the time, you start to have a lot of free time. So you start to think, there's a lot of time to the exams, and you can go out. And there's nothing wrong with that, because I've done that myself. But it's important to remember to also start studying quite early for your June exams for second year, because there are quite a lot of them. From what I remember, there's 6, not including all the practicals, especially for prosthetics, where you do need to pass the practical, and you do need to get at least a 4 in the practical for prosthetics to even be allowed to sit the oral exam for that. And if you get less than a 4, or you will have to retake that exam, the whole practical exam, when you come back in September, which is quite a long procedure. So apart from the studying, I do generally go out quite a lot with my friends. Usually we just go to, shish cafes or dessert cafes, just sit and have a laugh for a bit. Or sometimes some of my friends, we do rent cars and we go to different places in Bulgaria. So I have rented a car myself and been to Plovdiv with a few friends. We've also been to a mountainy area with caves called the God's Eye Cave, which is quite a nice place because there's a cave and there's like holes at the top of the cave. So if you look directly up at a certain time, you can literally just see the moon shining, like coming through the cave and nothing else. So it's quite a nice view. All in all, I think my experience in Bulgaria has been quite a fun one and quite an informative one. I have learned a lot of new things. Obviously, depending on where you're coming from, it could be different to your lifestyle or it could be similar. So I came from London. So for me, it was quite a change coming from London to Bulgaria. I mean, the streets look different. The language is different, everything's different here, even the universities, they look different. But it has been a beneficial experience, and there are a lot of places you can visit in Bulgaria which you don't have in London. So for me, it was quite nice. I think it's important to just enjoy it while you're here, because you're only here for a few years, so you might as well make the most of it. And it is actually quite enjoyable when you go out with your friends to different places, see new things, meet new people. So it's a nice change. I hope you enjoyed this video, and I hope that you did learn or pick up a few things at least from it.